Welcome back. It's now time for our social hour, and today we are discussing your sexual health. Exactly what happens to you mentally, physically, and also socially. And in studio we do have with us, that is Dr. Catherine Syengo Mutisya, to discuss this particular issue. She also works at the Nairobi Mental Health Services. Yes, she is a consultant psychiatrist. Thank you so much for being here today.
Thank you.
Right, so let me highlight this very quickly. Yesterday we had a lady who had texted us during our social hour, and she said that her husband is not very active in bed, and she's planning, no, rather she's thinking of having a mpango wa kando. So the fact that she texted in means that it's something that she's not really planning to do, but the way she feels, it's almost driving her there. Now, I think there are many different factors when we look at sexual health, not just he's inactive or she's inactive. Let's speak about the things that affect men and women. Let's begin with women. What kind of things, or rather when it comes to the health, physical health of a woman, that may cause her to slow down sexually?
Yes, basically when we are talking of sexual dysfunction or lack of interest in sexual activity, could actually be because of factors within the individual themselves. Probably if they have had history of sexual abuse, or if they were socialized and told that sex is a bad thing, and even when they were getting married they didn't get enough premarital counseling. Again, it could be actually medical issues, like a woman who has what we call pelvic inflammatory disease. They'll have pain, and so they will not be very interested in sexual activity. So it could actually be partner issues, your spouse, for example, how they treat you, how your communication, how you solve your conflicts. So it could also be drug abuse, because people who are addicted to alcohol, it can actually affect their sexual function. So it is both biological, it could be both psychological, and also the environment also.
And biologically for women, what, like you've mentioned one with the pelvis, but what other things that can cause a woman to slow down, not be active at all?
Yeah, the hormonal changes, especially when women reach menopause and they produce less estrogen, you find that the lining of the reproductive organs is thin, and so the sensitivity is affected because there are hormones which have reduced. Again, at the time after childbirth, because of the hormonal changes immediately after childbirth. Yeah, but again, women who might be on family planning, hormonal family planning methods, like the pill or the injections. Yeah, but all that can be you can actually deal with that if you have a very good relationship with your spouse.
Okay,
yes.
Right. And for men, what really affects men? You can also mention, like you did for women, the psychological issues, biological, basically what goes on with them.
Yeah, for men also, men tend to be affected a lot when it comes to psychological, about their work performance and the ability to provide for the needs of the home. So you find a man who feels that he's not doing well at work, they will be psychologically affected. But we also have medical issues also, like men who have had like treatment for prostate cancer, radiotherapy, or men who have had surgery for prostate cancer. Again, we also have hormonal changes, like people who are born with low testosterone levels. Yeah, basically also drugs, again, like alcohol. People are addicted to alcohol, it affects their performance. And other drugs, like as much as some drugs will induce or create the desire, they will not, the person will not be having enough energy or enough motivation to actually satisfy themselves or to satisfy their spouse.
Okay.
Yes.
And one thing that we mention but we don't take seriously is what we take in, our lifestyle.
Exactly. Thank you very much for reminding me about that. Because obesity, for example, affects your general health. We also have people suffering from hypertension, diabetes. All those are lifestyle diseases. High cholesterol levels. All those can actually affect your sexual health, both in men and women. Yes.
So what are the correct foods that one should eat? Because they always say groundnuts for men, they would help increase their libido. I don't know what it is for women, but let me say this aphrodisiacs, for example, like seafood and stuff like that. But that is one factor that people really don't consider, because we make sex look like a very social matter. It is a social matter, but like we keep on saying right now, it's an aspect that is affected by in different areas like psychological, biological. So, what kind of foods should people eat to make sure that they're healthy, they're active?
Yeah, basically I would advocate for a healthy, balanced diet where somebody eats the right quantities for their weight and height of the carbohydrates, things like starch, the rice, the chapati, the ugali, the starch, the proteins, and the vegetables and fruits. There are myths about wonder foods, like people will talk about watermelon, they'll talk about groundnuts. Most of those most of those foods are actually healthy foods, but they also increase, give an energy boost. So people have.
So it's true they work.
Yeah, somehow they work, but if you're eating all your groundnuts and you're eating all your watermelon and your relationship is not good, it's not going to work. Or if you eat all that and you drink heavy alcohol and every day, then it won't work. So it's a combination of many factors.
I like what you've said, that you may be having all the correct ideals, or let me say quantities of things that you're supposed to do, but your relationship with your partner has to be healthy for you to have a good sexual relationship. I think you can highlight more on that, the relation between the man and the woman.
Yes. Yeah, when it comes to communication, when it comes to men, for example, their self-esteem, if you have a spouse who is criticizing you throughout, or who keeps reminding you of your failures, then at the end of it, your self-esteem is affected and your sexual life is affected. For women, if you have somebody who you feel they don't care, even if they are providing, they are abusive or they are not supportive, again, that will affect your relationship. Again, we have external pressures, like work, like friends. Friends are good, but if all your time you're spending your time with your friends, then it can also affect your relationship. Other external pressures like children also, especially young parents, they spend so much time. Some even have their babies sleeping in their bedroom, and that also affects their social life. So basically, you have to improve the relationship with your spouse, the communication. We are seeing also young people coming to the clinics and saying, I think my sexual health, I have sexual dysfunction. We don't diagnose that unless you have regular stimulation. Because you need to have a partner with you who is doing the right thing. And so when we are diagnosing sexual dysfunction, when we have excluded the medical issues, you don't have hypertension, you don't have diabetes, your weight is okay, you don't have, you are not overweight, you are not obese. We have ruled out any other local issues like your prostate is okay. For women, you don't have a pelvic inflammatory disease. When we have ruled all that, then it would also be good to have your spouse or partner to come for the evaluation, so that we know that everything is going on well. Because most of the time for the psychological issues, when you improve the relationship, then the sexual life also improves. Yes.
Right. And let's speak about men taking Viagra because of performance. Now, it is said that it affects young men very, very much, and old men would even die because of overdose, because of trying to please maybe a 20-year-old, and let's say you're 58 or 60. Of course, you're not as, let me say, active. So could you demystify this whole aspect of Viagra? Is it entirely bad, or medically can it be used? And when it's used wrong, exactly what happens?
Yes. Yeah, of course, Viagra is a good drug when it's given as a prescription drug, when it's prescribed by a physician. And the problem is it's even being sold online. And people can even go walk to a chemist and buy it. And so you find people taking Viagra when they have not been evaluated. You also find them taking it when it is not prescribed. And so because of interactions of other drugs which you might be taking, because of your age, or other health issues like your blood pressure and other medical conditions, then you find that in some people it can actually cause death. And some other young people have delusions about their sexual satisfaction, and even when they have no problem, they would still go for it, which is not right, because it's prescribed when there's a problem. I forgot to mention that some medication can actually affect your sexual health. Like some drugs used in treatment for depression, some drugs used for treatment of hypertension. So it's very good when you have a problem of sexual dysfunction to actually, when you are seeing the doctor, you list out all the drugs you're taking, because sometimes it could actually be the medication you're on.
And know that you're not okay.
Not that you're not okay. There are people who will need those drugs to be assisted to be able to achieve an erection. So that is okay when it's prescribed. But if you use medication which is not prescribed for you, then you're actually abusing the drugs. Yes.
Right. So how can it be used for people who want to use? Because I mean, wanting to please your partner should not be a problem. The thing is, some people get an ego boost, for some men rather, from the whole aspect of saying, you know, I can do this, and I need to take this, you know, over-the-counter dose for me to be okay. And the way it will affect an old man is not the way it will affect a young man. But it is said that young men get affected because it eventually slows them down later on in their, you know, heydays. Yeah.
Okay, for one, I would want to clarify that nobody should take any drugs when it's not prescribed for them, because all drugs have side effects. It might be mild, it might be severe. So it would be very good that if this person feels that they are not getting enough satisfaction in their sexual relations, or they feel they are not satisfying their partner, it would be very good for them to be evaluated, so that if there is indication for them to be given those drugs, then they can actually be given. I am avoiding to specify one drug because there are various types which can actually assist people. And for the cases where they need them, they actually help them. And the problem is, even if you take the drugs, you still have you need to have a sexual partner with you to stimulate you. You don't just take drugs and you expect to get satisfaction when there is no adequate stimulation. Yes.
That is so funny. Right. Let's take a look at also social matters. Let's take a look at Africa. Of course, we're in Africa. We are a very conservative society, and some of the things that have come in that we see online, that we see in soap operas, we see in movies, some people are still of the view that this is not African. This is not in our culture, where a woman would be required to be very active or very bold, especially in a sexuality, or telling a man, I need this right now, or A, B, C, D. You'll find that some women will be criticized by their husbands. And one thing that it's said like a joke is, you know, no activity, no creativity in the bedroom, that will lead some men to, you know, like their wives will be quote unquote viewed as this very good women, nuns, quote unquote, and then they'll go and get a crazy woman out there now who will do all the crazy things because she is quote unquote prescribed to do so. So how do we go about a social, you know, matter that it has been there for ages? It didn't begin today. It didn't begin, you know, just you know, like recently. This has been there for a long time.
Yes, I think people really need to actually utilize premarital counseling and the so-called bridal showers, and which sometimes people don't actually advise the bride to be or the groom to be. But again, you see, when young people are growing up, they are socialized and told that sex is not good before marriage. But when they are getting married, nobody prepares them that now when you get married, that sexual activity is very important for your marriage, and you have to change your attitude and have the right attitude. So that is not, if that is not done, then you find adults who still feel it's like a sin when they're having sexual relations, and it will actually interfere with the way they approach about sexual activity. So it's very good for young people to be counseled on the fact that there are very basic things in marriage. You need to have the right communication. Sexual relations is very important in a marriage. Of course, there are other issues which you'll need to deal with, like finances. You will deal with external pressures, either from relatives or from work, or you will also deal with children. But communication in marriage and sexual activity are very important. And every person who is married needs to make sure that they actually consider sexual relations as a very important factor in their marriage.
Okay,
Yes.
and this is to our viewers. You can call in using the numbers at the bottom of your screen. Also text us on 20001. We're also on Twitter at K24TV. Our page on Facebook is K24TV. Tweet me at Remy Majala, and also our producer Chegeti, and tell us exactly what you think. Of course, a doctor here will be able to respond to your questions or comments. Yes, I think another factor we need to look at is what you say, premarital counseling. Can we really peg one factor as to be the reason as to generally why people would slow down in their sexual lives, both men and women? Because the counseling is very one major factor, that people sometimes get into things they don't understand. They may be traumatized, they maybe have a particular view, but is there one major factor that makes people just, zap out, if I may say?
Yeah, I would still emphasize that sexual dysfunctions can be caused by various factors. There are the individual factors, what we are discussing about, like if you have had history of trauma or history of sexual abuse, or you are socialized to feel that sexuality is sin and that is not corrected. Those are the individual factors which can actually be worked on through counseling, where you evaluate yourself, because you cannot make somebody else happy if you are not happy with yourself. If your self-esteem is not good, it will also affect your relationship with other people. But again, now there are other factors, because in a marriage you are dealing with two people, so you need to have do things the right way. You need to be informed, counseled on how the importance of treating each other kindly, the importance of being there for your spouse, the importance of supporting your spouse. So all those things are very important. Of course, through premarital counseling, it's also good to make sure that you've ruled out any diseases which could be there. When you do a general medical examination, people are supposed to have a medical examination yearly, but in Kenya most people don't do that. They wait until they are unwell. So it is very good for everybody to have a general medical examination,
and
like
exercise,
once a year, exercise,
and all those
eat
things.
healthy. Yeah, so that by the time you're getting married, you've sorted out all those issues, then you expect that if you are given the right information about sexuality, for example, what you need to do for sexual arousal for both you and your spouse, what is orgasm, what can prevent orgasm, because that is also a major problem for women. Yeah, and again, how you need to treat each other, that is very important.
Okay, and how do you deal with a partner who has, like you said, a low self-esteem? What should people do on that basis? Because this is someone who maybe, like you said, is traumatized about something or has a certain upbringing. What should they do?
Yeah, these can be corrected through intensive psychotherapy. It might not be done in one sitting, because we usually evaluate what the issues which could have led to the self-esteem. Probably it was the upbringing and a lot of criticism, or defining moments in your life, like you are embarrassed in presence of a whole school, or in presence of very important people at home, and that traumatized you. We lead the individual to identify what are these defining moments, and then there's something we call minimum effective response. For this trauma which happened to me, for these incidents which happened and lowered my self-esteem, I started viewing things different. What is the minimum thing I need to do to be able to gain closure? So when you unearth the past, you're not just unearthing it and leaving it raw. You have to gain closure by helping these individuals identify the minimum effective response they need to do. It might just be a letter you write and tell this person you did this to me, and you tear it. It might not necessarily be confrontational, where you want to go and shoot, why did you sexually abuse me, and shoot them. So the minimum effective response.
Yes. Hello, good morning.
Hello.
Yes, good morning. Tell us your name with your question or comment.
Yes, I'm Ben. I'm calling from Kagemi.
Yes, Ben.
I just want to ask the doctor that if a man is very
If a man is very
happy with the wife and they are living well.
Okay.
But in the time of now having sex and all that.
Go on.
Hello?
Yes, we can hear you.
Yes, and having sex and all that. When you ejaculate, you just go down. and you just gas once. Then you lose the power to continue. What can be the problem?
Okay, thank you very much.
Yeah, thank you very much, Ben. There is treatment for that, where we actually help the person through psychotherapy, and also some drugs can be used to help that, to delay the ejaculation so that they are able to satisfy themselves and also to satisfy their partner. So we need to evaluate them, because some treatment they might be on, if they are on any treatment for any disorders, could actually contribute to that. Other diseases like depression could also contribute to that. So they need to have an evaluation to find out the cause, and it can actually be corrected, both through psychotherapy and through there are drugs to help that.
Okay.
Yes.
So let's speak about the checkups. You said something very important, that one should go for a checkup yearly, but we don't go.
Yes.
So is it the same for men and women? Is it also yearly, or for women it's a series of months, like for example the pap smears and the and the like?
Yeah, a yearly examination is good. If the doctor finds that there is something which needs to be followed up closely, they'll advise you. But if you go for a checkup like today and everything is okay, then you would be advised to come back after a year. Because even pap smear for a woman, a yearly test is good. But basically, when you go for evaluation today, for example, you might be told your BMI is on the high side, you're overweight, or you're obese, so you need to work on your weight, and therefore you're given regular reviews so that you can correct that. If there's any medical issue, you're given shorter appointments. But if you go for a test and everything is okay, then a yearly is good. If Kenyans went for tests every year, then we'll prevent many diseases.
Most definitely.
Yes.
And I think we should also take a look at how we should look at the whole aspect, like I mentioned, for social matters. But before we do that, let's take a phone call. Hello, good morning.
Hello, morning.
Yes, good morning. Tell us your name with your question or comment.
My name is Catherine Mwangi.
David.
Yeah, nilikuwa nauliza. I'm infected with genital herpes.
Okay.
Na mtu wa papa tuna.
Hello?
Hello?
Yes.
Sasa. Huwa nimeenda kwa hospitali, lakini bado nimeona sitapata dawa nzuri. Sasa nikienda kufanya vaccine, naona kama iko chini. Sasa wewe can improve my sexual level.
Okay.
Okay.
Thank you very much. Genital herpes is a sexually transmitted disease, and it can actually be eradicated through treatment. But the person needs to see a doctor so that they actually make sure that the diagnosis is correct, because there are many lesions which can affect the genital area, and if the correct diagnosis is not done, you could be treating the wrong thing, and so explaining why it's not going away. So I would advise the person to visit a doctor and to have the correct diagnosis made, and if the correct diagnosis is made, then the right medication is given. Their spouse might also be involved, or their partner, for treatment, and eventually when it's clear, they can be able to enjoy a normal sexual life.
Okay. So when you say normal sexual life, let's go back to social matters. How can someone just, they need to create their own ideas in the bedroom, because, depending on what they like, without always looking back, or this is, the woman is supposed to be in this particular way, or my husband should not tell me to do A, B, C, D, just to have a healthy mind frame, because there are very many inhibitions as to why someone would not be very free with their partners and would go out and be free with this stranger or someone they just met. So how can they get their mind out of, that particular rut?
When there's proper communication and friendship, then couples can actually be able to be free with each other and be able to communicate, and that is very important. Again, you need to be, every couple or every individual needs to understand the importance of satisfying your sexual partner, to the extent that if then if you're not satisfying them, then they might look out, although I'm not justifying that. So it is very important for everybody to actually make sure that, for one, they understand the importance of sexual relationship, the sexual relations, and they give it the importance it requires, so that they are able to be flexible, discuss about it, and they are able to satisfy themselves and also to satisfy each other. Yeah.
And I think one mistake that most people do is looking at their partner like what every other person, you know, would want or need. You read magazines, you go online. Of course, maybe you want to help yourself, you know, as to getting more information, what you need to do. But how important is it to learn what your partner wants and needs as regards to looking online, reading magazines, and placing your partner, a man or a woman, either, you know, in a basket as with the rest of everyone who would like A, B, C, D. Like you said, communication is very important.
Yes, yes. So it would be very good to actually be free and discuss all those fantasies you have with your spouse, and your spouse should also listen, and you agree on what is acceptable for both of you and what is not acceptable, because we've said when people are not getting sexually satisfied in a marriage, they will not also perform at work well.
But how
they
do you
not
deal
relate
with traditional people with traditional mindsets?
Yeah, and that's what I'm saying. People need to be properly counseled, because you grew up, your mom and dad told you you should not play with boys. They didn't even actually tell you don't have sex with boys. They're telling you don't play with boys or don't sleep with boys or usifanye tabia mbaya. So people need to be told the nitty-gritties about sexual relations, and we actually advocate for parents to actually answer questions truthfully for children, regardless of their age. When they ask you a question, be honest and use a language they can understand. Don't tell them babies come from the supermarket.
Yeah, or cabbages or stuff
yeah.
like that.
And when a child reaches puberty and adolescence, you actually need to explain to them. When you're telling them don't have sex, what is sex? You need to explain to them so that they actually understand what is sex and why it shouldn't be done at that time, why it should be delayed. When people are getting married, that is also the crucial time where people need to be given all the details. They need to be told that sexual relationship in a marriage is very important, and they need to value it and make sure that they understand everything about it and they learn all they can about it, so that now whatever you've always ambered in your mind, you now discard it and replace it, that you need sexual activity in a marriage.
And sex education, is it now more free and you know, more spoken about, you know, compared to how it was done before? But before you answer that, we have another phone call. Hello.
Hello.
Yes, good morning.
Morning, how are you? My name is Pascal.
Yes, Pascal. Okay.
Yeah, actually,
Yes.
this FGM, which is being discouraged, how does it affect sexual life in women? And you see, my comment is that actually kama ni mafundisho kuhusu mambo ya mapenzi na kufanya hiyo mapenzi, zamani ilikuwa watoto walikuwa wakifundishwa, they are being taught actually through kupitia kwa mashangazi, you know. Ilikuwa na hizi cultural days ambapo watoto wanapelekwa kama vile Meru, unakuta kuna siku za kutairiwa nini, you know. So actually it used to happen, but nowadays unakuta kwa sababu ya wazazi hawajihusishi, imekuwa shida sana.
Right.
So sijui kwa nini inakuwa hivyo, but shida nyingi zinatokana na wazazi wenyewe.
Sawa.
Watoto kujihusisha na mambo haya mapema kabla wakati haujafika.
Okay. Thank you very much. He has a very important point. Actually, the thing is, right now I find that some parents are not very free talking to children about, you know, sex education. But whereas in the traditional society, let me speak about the coast, you're taught from a very you know, young age, how to be a lady, you know, dress as a lady, you know, eventually in your teens, how to take care of your husband and the like. And many other communities, you know, were following suit. They were doing actually the same things right now because of, you know, the urban areas and families, you know, some of them in the rural homes and stuff like that. What exactly, you know, is affecting our generation right now?
Yes, I agree with you. There's some breakdown in the traditional setup where some of that education was inculcated. But I also want to correct that some information given to young boys and when they are initiated after circumcision could actually be harmful, because we know there are some places where young boys who are 12, 13 after circumcision, they are told now you're a man, you can have sex, you can you should actually try it. I'm told there are some communities where they tell you for the scar to get healed you actually have to try sex. So we also need to be careful what information we are passing to children at that age. But it is very important that by the time a child reaches puberty, they need to understand what sex is and what are the dangers of having sexual relationships at an early age, what is safe sex, because again we know that some children and adolescents, even though you tell them that sex should be delayed until marriage, they would still go out and have it. So they need to know what is safe sex, that if you're stupid enough to have sex before this age, then you must use protection, because if you don't pass the information, then eventually they might make the wrong choices.
Okay.
Yes.
Right. So there's a question here very quickly. There's a lady who's saying that she loves her husband very much, but she hates sex and she doesn't get turned on very quickly. What's the problem?
Yeah, when a lady says they hate their husband, probably...
No, she loves her husband, but
sorry.
hates sex.
Hates sex, yeah. We would want to actually find out what is our socialization concerning sexual relations, especially in marriage, and make sure that she has the right information. We would also want her to really, you know, through cognitive therapy, to understand these sexual relations in a marriage is very important. And you actually need to emphasize on that and actually work towards it. Make sure that you are able to satisfy yourself and satisfy your partner. So basically we need to actually work on our thoughts so that she has the right thoughts, and actually give her skills, because some women might not actually have the right skills. And again, the spouse is very important, how you treat your wife, for example. If she feels loved, then everything will just go on smoothly. But if you're abusive, if you don't take care of her other emotional needs, we say for you to have sexual intimacy, you have to have verbal intimacy.
Okay.
So you have to be friends and be able to communicate clearly.
Right. So there's another question where a lady is saying that her son is sexually active, like he's addicted to sex. So whenever he's denied by his girlfriend sex, he cries. How can they make? She's asking how can she make him stop?
Oh, that's an interesting
What
relationship between a mother and a son. So, to the extent that the son comes to tell the mother when they've not had sex, it's an interesting relationship. But probably if this man is old enough to be able to have sexual relations, then they can also be able to seek treatment or evaluation together, independently. Because again, when you involve your mother or like in-laws into your relationship, it
He's
gets
20
worse.
years old.
Oh yeah, he's 20 years old. Yeah. So it would be good. I actually advise couples to actually seek for advice from not from family members, from independent people, so that they can actually get the correct advice.
Hello. Good morning.
Good morning.
Yes, tell us your name with your question or comment.
I'm Wycliffe, calling from Nairobi.
Yes, Wycliffe.
Okay, one comment I want to comment about a lady who sent a text or she called.
Yes.
She's saying that she hates sex. Though I'm not a specialist on that line, but I believe that maybe the way the husband might be treating her, or maybe the husband needs sex when she's not ready for that sex.
Oh, but Wycliffe, she's saying that she loves her husband. She just hates sex.
Sex. I'm saying she hates sex.
Yeah.
But she loves the husband. You can love the husband, but when it comes to the issue of sex, it's a different thing
Right.
So that's why I'm saying this particular woman they need to talk it out with the husband and see how best he can start loving sex herself and also with the husband.
Okay.
The communication between them should be effective. Both the mind and both, as the doctor says, emotionally and by so talking.
Okay. Thank you very much, Wycliffe. Thank you. Right.
Welcome.
So you were still answering the mother of this particular young man who's addicted to sex, and he cries whenever he's denied. Yeah.
Yeah, I began by pointing out that their relationship is quite interesting. When a son is not sexually satisfied, they would go to tell the mother. They would go crying to the mother. So, sometimes also the relationship between the son and the mother, if it's not properly done, if it's not correct, then it can also affect their relationships in their marriage and in their later life. Yeah, but sexual dysfunction or lack of satisfaction, regardless of the age, you need both partners evaluated. Just like the caller has just pointed out correctly about the woman who says she loves the husband but she doesn't enjoy sex or she hates sex. It would be very good to actually understand whether there are any local factors, like is she having an infection? Do they communicate well with the husband? If there is any discomfort, does she point out to the cause of the discomfort? So there are many issues, and our culture also doesn't allow us to talk about these things openly. Probably there's somebody listening there and wondering, why are these people discussing this topic?
It's in the it's what's happening around. We deem to want to have this ideal society, but this society has real problems. So anyway, quickly, we have 3 questions. The first one is a man who said that he slept with a lady and she's discharging yellow substance. Should he go for checkup? And
definitely,
he should go for checkup.
Yes, because discharge needs urgent evaluation and treatment. It could be gonorrhea, it could be any other sexually transmitted disease, so they need to be evaluated and treated.
Right.
Yes.
The second one is, how does masturbation affect sexual performance?
Yeah, masturbation and pornography also, when people get addicted to these 2 aspects, then it affects their sexual life later on, such that when they are married, they are not able to satisfy their partner. It could contribute to early ejaculation before you have satisfied yourself or you have satisfied your partner. So people need to avoid getting addicted to masturbation and also to pornography.
Okay, and the last question is by a man who's saying, does alcohol affect sexual performance in men? But of course, you mentioned it, but I think you can help him out.
Yeah, we had mentioned it, that the amount of alcohol. You see, we always say that if you must drink alcohol, then you must do it in moderation. And in moderation, we talk of at least only 2 drinks in a man and 1 drink in a woman. When you talk of 2 drinks, we are talking of either 2 beers or 2 glasses of wine, and glasses of wine are smaller than a normal glass. If it's spirit, because of the concentration, it has to be at least not more than 2 tots for men and 1 for women. So when people do in excess of that, it will affect their sexual performance.
So generally for men or women, it affects them?
Yes.
Okay,
yeah.
Right. So doctor, thank you very much for coming in today. Of course, the rest of the questions, I believe the audience would love to have your number or the address for your clinic, or how can we get in touch with you?
They can email at nairobimentalhealthservices@gmail.com.
At?
gmail.com, Nairobi Mental Health Services.
Or at Nairobi, no, they can email Nairobi Mental
Health
Services at gmail.com.
Yes.
Okay, got that. Nairobi Mental Health Services at gmail.com. And she is Dr. Catherine Syengo Mutisya, who's been very open about this particular matter, which I believe it should be. And, any question that you may have, please email her, and she'll be able to answer your questions. Thank you so much for coming in today.
Thank you.
Right, that's been Social Hour, and take a look at our funny clip right now. And coming up shortly is Samba Chat. It's where we involve our sports gurus to tell us exactly what we expect during the World Cup. And it's this Thursday, so I hope you're bracing up for it, but stay tuned for that.